Hi, this is Dr. Sandy C. And today I want to discuss with you 5 necessary mindset shifts when any physician is considering a pivot from clinical to non-clinical medicine, whether part-time or full-time or a combination of the two. Why am I emphasizing these 5 necessary mindset shifts? Well, personally, I really believe that this whole journey starts in the mind. And when I say that, I'm really not being woo. But let's face it, all of our actions do start with some sort of thought or some sort of pattern of thinking. Now, I'm in no way a psychologist, psychotherapist, or mindset coach, so if you need mental health counseling, I would definitely recommend that you seek that out, whether you're considering a pivot or not. So let's go ahead and get into it. Crucial mindset shift number 1. Recognize and embrace your why. Everything that we do starts with a why. And I think that it's important for you to know your why, not for everyone else to know your why, but it's important for you to know why you are seeking this non-clinical pivot. The reason why it's important is that you may face rejection. You might face bumps in the road. You might face criticism or questions from your family, from colleagues, from social media. So it's important as you walk this journey for you to always start with your reason why. And this is unique to you. And it doesn't have to be justified to anyone else. That's not why I'm encouraging you to consider your why. It's because throughout your journey, as you embark on this career pivot, as you go through interviews, get job offers, and make crucial decisions, there may be moments when you second guess yourself. So it's really important for you to know why you are embarking on this journey. Perhaps you should take 10 to 15 minutes to reflect on this. Answer these 4 questions. What is driving your desire to leave clinical medicine? Be honest with yourself. You don't have to share this with anyone, but just be honest with yourself. What's driving your desire to leave? And don't get me wrong, once again, you don't need to justify this to anyone. You're free to do whatever you want to do with your career. 2, have you sought therapy or coaching? Because remember, like my life coach, Dr. Jeannie Lawrence, told me, wherever you go, there you are. So it's important that if you're burnt out, if that's your reason why, you address that as you're making your career pivot. It doesn't have to mean that you're making the wrong decision by pivoting your career. It's just that you really don't want to take your same burnt out mindset and point of view to your next job. It takes a while to recover from burnout if that's where you are, but definitely start your journey toward addressing that burnout as you make these crucial decisions and pivots. That way you can actually enjoy and reap the benefit of a lower stress job and career. What do you hope to gain from your non-clinical career pivot? This is unique to you. And again, this is not a call to justify yourself at all. It's just important that you know what it is you want to gain, how you want your life to look, what you want to change in your life and in yourself, maybe in your family, because of this career pivot. So take some time to think about that, because this is going to be crucial when it does come down to actually choosing a job once you get some offers. You're going to want to make sure that you know what you want out of life and what you want out of your career so that you can line that job up against those goals and desires and see if it's going to be a match. Even if it's not perfect, you want to make sure that you're not jumping out of the frying pan into the fire. Number 4, I want you to reflect on how this transition will improve your life personally, professionally, and financially. As you reflect on this, I want you to go back to the previous questions, because once again, this is a big move and you may second guess yourself along the way. Everyone's journey is different. Personally, I didn't second guess myself, but I know that a lot of physicians, they may second guess themselves. They may have to answer difficult questions from colleagues or family members. So just know, what do you want this transition to improve? Personally, I wanted a regular schedule because late nights were really taking a toll toll on me. I was just having a harder and harder time recovering from swing shifts and late nights and leaving the ER after an on-call shift at 2 a.m., 3 a.m., wired, tired, could not sleep well. After over a decade of that, my body was just not rebounding and recovering. So one thing I knew I wanted was the chance to get rest, the chance to sleep when the rest of the world was sleeping if I chose to do so. What is it that you're looking to improve? Personally, I also wanted to be able to engage in more social activities that required me to have a more regular schedule. I had a great schedule, week on, week off. It worked great for a few years, but after a while I found that my life was so out of sync with my family and people I wanted to spend time with that I was completely available when they weren't available, and when they were available, I wasn't available. So I personally decided one of the changes that I wanted was to be on a regular schedule so that I could participate in regular type of activities, go to church every Sunday, never have to miss out on a weekend event, a family birthday celebration, or what have you. It's just those little things that started adding up when I found that I was missing out on really 50% of life. That's just me. That was my experience, and that was a big part of my why. Remember that your why is your compass, and your why is also going to be your measuring stick as opportunities present themselves. You're going to know better what to look for when you know what you want. Mindset number 2, and this was really huge for me. And I have to admit, I didn't arrive at this mindset shift by myself. I had a life coach, and I also took in a lot of content every day when I was considering my career pivot. Probably for me, the second most important mindset shift was for me to reframe and reclaim my skills and credentials. It was important to me to realize that my MD, my years of clinical experience, the communication skills, and all the skills that I had acquired through the years, through training and through working in clinical practice, were indeed mine. They were being utilized at my workplace, but they did not belong to my workplace. Truth is, at the end of the day, if I were to have some career snafu that would have caused me to lose my credentials, my employer would have swiftly shown me the door. So basically, I had to realize, hey, this MD is mine. I didn't get here by myself. I had the support of family, friends, mentor, my residency program, people in my workplace who took an interest in me and helped me along the way. But at the end of the day, these skills were mine. I took ownership over them, and I learned to value them. Remember, you bring more than just clinical expertise to the table. You have leadership abilities. If you're a physician, you're a leader, point blank, period. You may not have a leadership title, but every time you write an order in a chart, every time you give a patient advice, every time you spend 30 minutes counseling a patient over a life and death decision, every time you get on the phone to speak to a colleague or consultant to discuss a case and prove your point and, argue for your patient's well-being, you are showing leadership skills. You have people skills. Sometimes we have good people skills, sometimes we don't. That's something that we can definitely develop over time, and most likely you have developed those people skills to some degree over time. In all fields of medicine, you're dealing with people, even if you're not directly facing patients, even if you're not a primary doctor or cardiologist, you might be an anesthesiologist or radiologist, but you're still dealing with people. No one in medicine doesn't deal with people, whether it's other physicians, colleagues, nurses, techs. You have developed real people skills through the years. So I want you to sit down and reflect and even list out the skills that you have acquired through the years, all the way through your education, training, and practice. I want you to recognize them, and I want you to reclaim them as your own to utilize in the way that you see fit. Mindset shift number 3. You have to prepare yourself to leverage your transferable skills. Now, this obviously ties back into mindset shift number 2. I think it's important first for you to recognize what skills you have. After you do that, as we mentioned in the last point, then it's important for you to leverage them. That means you've got to use those skills, all of your experiences, to show your next employer what you will bring to the table. Believe it or not, your skills are highly valued, not just in medicine, but outside of medicine. What I found is that in the medical field, of course, as a physician, we were important, but there were just many, many physicians. When you go outside of the medical field to other industries who need physicians, then you really begin to recognize how important your leadership skills are, your medical knowledge, your ability to critically think, your ability to handle decisions under pressure. For those of you who are in patient-facing fields of medicine, you know that over the years you become quite skilled at even making life and death decisions under pressure in a split second. I think that really helps when you're shifting to a non-clinical career. If you can handle those types of decisions and that kind of pressure, believe me, you can handle the pressure of a non-clinical job, which, by the way, is usually nothing like the pressure you will face in a clinical setting. So I want you to sit down. Now that we've gone through exercise number 2, you've listed and reframed and reclaimed your skills. Now I want you to recognize how those skills are transferable and how they can be not only useful, but actually valued and crucial in a non-clinical career and industry. Mindset shift number 4, invest in relationships and networking. Now this is not always easy. It depends on your personality. Personally, I am introverted. I call myself a functional introvert, meaning I can definitely carry on a conversation with just about anyone, but pretty much I don't necessarily seek out those interactions. I recharge the best on my own. So being an introvert, it's a little bit against my nature to network, but it's really important. Other people are important. We live in a world full of people, and whether they recharge or drain us, we have to make connections with others. And as you reach out, you'll probably be surprised that other people out there in the world who have similar interests and goals to you are very willing to connect with you. So I would say as you embark on your clinical to non-clinical journey, start getting to know other physicians who are seeking similar opportunities and who have already made the leap. For me, I have to say that networking is what made my clinical to non-clinical transition very fast and very easy. And my intention was not even to network with my colleague. I was just sincerely asking them questions and having an organic interaction. And that led to me landing my first non-clinical position. So remember, people are important. I mean, you don't have to be disingenuous. You don't have to be fake. You don't have to schmooze. Just connect with people who you resonate with, and you might be surprised what doors that may open for you organically. And last, but certainly not least, and actually probably most importantly, don't be afraid to let go of the golden handcuffs. I think this is the most important mindset shift because many, not all, physicians, even if we're not completely happy or satisfied in our current clinical position, we know what to expect. We know the ups and downs. Most likely you're being paid decently, maybe not as much as you want, perhaps not the most competitive salary depending on where you are, but you're probably able to pay your bills and live at least a fairly comfortable lifestyle, at least. You probably have good benefits. You know what to expect from week to week, even if it's pure misery. You know what to expect. You become comfortable. You know when those bonuses are coming through and when you're going to be able to perhaps make some purchases that you need to make or go on a vacation. You know how much vacation time you have. Wherever you are has most likely to some degree become your comfort zone. But I want you to ask yourself, does staying in your current role serve the life that you want for the long term? If it does, congratulations, that's great. But if you are considering a career pivot, please don't assume that if you pivot to a non-clinical career that you're not going to be able to pay your bills, that you're not going to get paid, you're not going to have health insurance. That can be a real fear, rational fear, but a fear. Physicians often do feel trapped by the need for security. We're used to feeling a fair amount of job security for the most part. Stepping away can really be scary, but staying unhappy in your current role or your current career choice is not the answer. So in order to let go of those golden handcuffs and free yourself, it is necessary to shift your mindset to realize that not only are your skills valued, but you will be well compensated in other fields. If you're not in a situation where you have to urgently find a job, take your time and look for a job or career option that is going to keep you fairly fairly comfortable financially if that's a priority for you. This was definitely a fear of mine as I first considered a career transition. It was just easier to stay where I was. I was very grateful, for steady work, and it was just easy to stay stuck, stay where I wasn't 100% happy or growing personally. With the help of my coach, who are putting out content on podcasts, I was able to make that mindset shift, able to work through those fears. You don't just ignore them, you work through them. And over time, you realize, okay, the grass might just be greener on the other side of the fence. Thank you so much for tuning in to my podcast. I hope that you found some of these mindset shifts and tips to be helpful. Please see the description for more information on how to connect with me and how to help me form a community of like-minded individuals who are seeking a career pivot. Let's go beyond the doctor's lounge together.